Thank you for joining Drug Free Workplace PA. Today, we will discuss the cost of substance use in the workplace, the supervisor's role, reasonable suspicion, and resources. 38 to 50% of all worker compensation claims are due to substance misuse in the workplace. Employees who are impaired from substance use file 3 to 5 times as many worker compensation claims than those who do not use. Substance users incur 3 times higher medical costs than non users. It's estimated to be $25 billion each year. Substance users are 2.5 times more likely to be absent 8 or more days per year. And substance impaired employees function at approximately 67% of their working potential. It's an estimated 80% of substance users supported their drug use by stealing from their place of employment. Chronic work stress may increase the risk of addiction if not managed in healthy ways. It is important to be aware employees may self medicate to cope with the stressors of the workplace. Self medication happens when a person uses illicit drugs or misuses prescription medications or alcohol to deal with situations they find stressful or difficult. Many people think that people who use illicit drugs or misuse drugs and alcohol are not employed, but the reality is over 70% are employed. It is important to note that binge drinking is defined as having 5 or more drinks in a 2 hour period. According to the American Cancer Society guideline for diet and physical activity for cancer prevention, it is best not to drink alcohol. People who choose to drink alcohol should limit their intake to no more than 2 drinks per day for men and 1 drink a day for women. The most common illicit drugs used among employees are marijuana and cocaine. Marijuana is still federally illegal and illegal in Pennsylvania for recreational use. If an employee has a medical marijuana card, it should be clearly addressed in the drug free workplace policy. With that being said, being under the influence or impaired at the workplace is not appropriate and can result in discipline or termination. Please view the medical marijuana education on the website for more information on medical marijuana in the workplace. Some employees with substance use disorder are considered high functioning and are able to reach personal and professional success despite the substance use. However, high functioning does not mean healthy, and eventually the addiction catches up with the individual and affects every area of their life. Alcohol remains the number one most misused substance. More than 80,000 people die from alcohol related deaths each year in the US. Over 1 million adults in the US have alcohol use disorder. 40% of all hospital beds in the US are being used to treat health conditions directly related to alcohol misuse. It's reported that 1 in 13 working adults has an alcohol use disorder. Shift work, such as overnight shifts and swing shifts, have been associated with binge drinking, and 47% of industrial injuries can be contributed to alcohol use, and up to 40% of industrial fatalities can be contributed to alcohol consumption. Substance use disorder impacts our families. 1 in 3 adults report substance use or addiction within their family. 42% of these individuals admit being less productive or distracted at work due to substance use or addiction within their family. How does a supervisor create a drug free workplace? A drug free workplace program provides a safe working environment for all of its employees. It protects the employer's assets from theft and property damage, and it offers treatment or resources for recovery and other mental health disorders, including the Employee Assistance Program. It promotes the health and well being of employees, and it provides training for supervisors and employees. Drug free workplace policies should clearly state its purpose and answer questions such as: what is the purpose of the policy and the program? Who is covered by the policy? And when does the policy apply? It must use clear and concise language so that every employee understands the policy and what is expected of them. Defining terms such as reasonable suspicion gives the employee an understanding of what behavior is prohibited and what a supervisor's role is in reasonable suspicion. Does the policy include drug testing? If so, it needs to be outlined um, the exact procedures so both the supervisor and the employee knows how to handle drug testing after executing reasonable suspicion. What are the consequences for violating the policy? Is there a return to work agreement? How is the employee's confidential information protected? It should address what type of assistance the employer offers for the employee in seeking treatment or other resources, such as an employee assistance program or other community resources. The supervisor's responsibility is to maintain safety and productivity. It's also to evaluate the employee's job performance and treat all employees fairly. A supervisor's responsibility also supports and adheres to the drug free workplace program. The supervisor does not need to have all of the answers or diagnose the employee. The supervisor does not need to provide counseling or therapy, and he or she does not have to be the police officer. An employee assistance program is a confidential service provided by the employer or labor union to help employees and their families resolve personal or work related stressors. It's a confidential service, and the information will not be shared unless the employee gives written consent to share their information. There is an exception that includes disclosure of threat of harm or to self or to others. However, this is still kept separate from the employee's personnel file and will not be shared with the employer. This is a no-cost service. Once EAP services are exhausted, typically the employee's health insurance will cover any additional costs. This is a 24-hour service, so it is available to the employee or their family member at any time. Reasonable suspicion are observable facts, physical, mental signs, symptoms, and behaviors of an employee leading a trained supervisor to reasonably conclude the observed condition and/or behavior is caused by a prohibited substance. It is not a generalized belief or gut feeling about someone or a group of employees based on characteristics such as stress, ethnicity, or age. Under the influence means having a diminished capacity, emotionally, behaviorally, or physically, that affects safety. It's also a condition of being unable to perform a task as a consequence of a substance, and it's showing signs and symptoms of impairment. These are just some of the top barriers that a supervisor might not execute reasonable suspicion. Maybe the supervisor has not been trained in signs and symptoms or has a comfort level with the reasonable suspicion process. Or maybe the employee is a friend of the supervisor and they don't want to get them in trouble. Drug Free Workplace PA has created some resources for supervisors to help ease any of the barriers that may exist. Please go to our resources tab on our website to download the reasonable cause guidelines and tips. The next steps for the supervisors, once they've recognized that someone may be under the influence of a substance, is to complete the reasonable suspicion checklist or reporting form. Document all of the details of the incidents or accidents, and have another supervisor observe the employee and document the observations. Ask the employee to meet in a pre designated private area to discuss the conduct of work performance and your concerns. Tell the employee about your concerns and conduct performance directly. Review the employer's drug free workplace policy and remind the employee that he or she agreed to the policy at the date of hire. Review the objective documentation again with the employee. Do not make any allegations of substance use. Focus on the documentation and conduct and work performance. Reinforce the drug free workplace policy and also state that to rule out any kind of substance impairment, testing must be completed as per the policy. If the employee admits to drug use, testing should continue as per the policy and also for documentation. The lab should be notified the employee is on his or her way for drug testing. It should be decided ahead of time on how the employee will be transported to the lab and also how the employee will get home once the test is completed. You can offer to call a family member or friend, and in some cases, some companies call a taxi or a Uber. If the employee insists on driving themselves home, it is best practice to call the local law enforcement agency to ensure the employee's safety and the community's safety is protected. Once the test results are received, schedule a meeting to discuss the next steps. It is important for the employee to have the EAP information or other community resources available at the time of this meeting so that the employee may be able to access help if needed. Will this employee return to work, or is this a case that the employee needs to be terminated? Here are some do's and don'ts for supervisors. Again, focus on the performance and conduct. Have your documentation in hand. Remember, things will get worse without intervention. Discuss resources and EAP with the employee. Always be objective and fair. Remember not to diagnose the problem or inject your own bias or moralize the situation. Do not discuss any substance use. And do not be misled by sympathy evoking tactics, but remain objective. And do not enable by making excuses or covering up the issue. Drug testing is the biggest deterrent for employees for misusing substances. It also prevents hiring individuals who uses illicit substances. It can also be an early identification tool of a possible substance use disorder. Drug testing also ensures workplace safety and can also mean a benefit from the workers' compensation premium discount programs. When drug testing, here are some things to remember. Was the employee treated with respect and dignity? Did the discussion take place in a private setting? Were the facts objective and understood? Was the drug testing conducted with integrity and quality? And was the employee given resources to seek help if needed? If there is a return to work agreement and the employee is coming back to work, they're going to need continued feedback in conduct and performance, positive affirmation, and constructive assessment. They will also need accurate and fair evaluations. If that employee is seeking treatment, support and encouragement is essential to follow through with the help and treatment. Also, if they are on their pathway to recovery, they are going to need time to adjust to this new next chapter of doing things differently. Respect for his or her privacy is crucial, and always have open lines of communication. If old behaviors appear, corrective action will have to take place. We want to remind you that recovery is possible. 10% of all American adults are in recovery, and most contribute to their recovery to supportive families, employers, sponsors, and support groups. For every dollar spent on substance use disorder treatment, society benefits by more than $12. How? People in recovery contribute to the workforce. Absenteeism is down, healthcare costs are down, reduction in criminal activity, and they are also better influences at home. Please visit the rest of our website and explore all of the resources that we offer. If you or a loved one is in need of help, please contact PA Get Help Now. Thank you.